Hi, Dr. David Ajibade here, and I want to talk about strokes and what happens when there's a stroke. And I think it's important that people understand this so that when you're seeking for help, medical help, and you're looking to to get the best possible recovery, best possible outcome from a stroke, you want to be sure that you're covering all the bases. And I gotta say, the reason why I'm doing this video is because when I speak to physiotherapists, physical therapists, rehabilitation specialists, and so on and so forth, I see that there are key pieces they are missing when it comes to this treatment, and therefore that's why these people, the people who have suffered strokes, don't recover like they should. I've had physical therapists who have been working on patients for 2 years, 3 years, 4 years, 5 years, and nothing. The patient says they haven't seen any results. To me, that doesn't make sense. It doesn't make sense to me at all. Well, it does. I mean, you can understand why, because they're missing out in a crucial piece, which we're going to discuss further. But I'm going to say this. Many of the patients that I treat are remote. I have never even laid eyes on them before. And basically, I just go by the information that the caregiver gives me, and then we recommend some nutritional products, building blocks, and then within weeks they see results. In fact, significant results within weeks. And again, it's what the parents or the caregivers tell me. So my point being this: when it comes to strokes, you've got to understand the ramifications of the damage, and secondly, you've got to know what to do to repair that damage and where the building blocks should be. Back to physical therapists, the problem is that they'll just focus on the exterior, just focus on strengthening those limbs and those muscles that have been affected as a result of the stroke. But that's just the secondary damage. How about directly addressing the damage in the brain itself? Because that's where the stroke happens, is in the brain. But it's not just in the brain. So let's just talk about that a little bit. Before we say what happens what happens when the stroke happens, we got to quickly understand the place of the brain in the rest of the body. There are about 12 systems. Some people say 13 or 14, but there are about 12 systems in the body. I'm not going to list them, but the three most important systems. Well, I'm not going to put it that way because I'm going to switch things a little bit. But the three systems that control all the other 9 or 10 or 11, the three systems that control the rest of them are the nervous system, the endocrine system, which produces the hormones and regulates the hormones, and of course the immune system. These three control everything. I mean, so if anything happens here, if you fail at controlling or feeding or improving any of these, you really can't expect to get any good results. So you're right there. You can see the some missing pieces already. The immune system isn't addressed. The endocrine system isn't addressed when a person has a stroke. The brain is addressed a little bit. So they give them omega-3s, maybe vitamin B or vitamin C. And of course, physical therapy tries to get them to move, and indirectly, by doing that, they hope that the brain will heal. It doesn't work most of the time. So let's see what actually works. If there's this damage to the brain as a result of a stroke, it's like a poof, it's like a disruption. It's like boom. Remember the ancient verse that says, "Strike the shepherd, and the sheep shall be scattered"? Well, that's really what happens here. You strike the brain, which is the head honcho, the controlling body in the entire body, the controlling organ, the controlling system in the entire body, and these all go into disarray. So, for example, there's less control of insulin. There's hormones control sex, so obviously the person doesn't want to have sex. Sex is probably the last thing on his mind. The immune system goes haywire, right? So you're going to have a lot of inflammation, not just in the brain, but other parts of the body. So a lot of things are going to go wrong. And so therefore, if you're going to be dealing with the brain, if you're going to deal with any person with a stroke, you can't just leave it at the brain, and you can't just leave it at the brain. You got to address the endocrine system and the immune system as well. But here's another thing that people don't realize. You also want to address the cardiovascular system and the heart and the blood vessels, because a stroke, by definition, is a problem with an artery. That means that the blood flow was disrupted to a certain part of the brain. So you want to provide nutrients and building blocks that will help to fix these arteries and restore circulation. The heart is also dysregulated as a result of what happens in the brain, but the brain by definition is an electrical organ. The heart works on electrical impulses, electrical transmission. So it disrupts electrical transmission in the brain, the heart still becomes irregular and dysregulated. And with drugs that can control that. Now, here's the other aspect that, in my opinion, is completely overlooked. And that's when it comes to the digestive system, right? So this is the stomach. I know you can understand that. So this is the stomach. What we now know is that the brain and the guts, that's the stomach and all the intestines and everything else, have a very, very intimate relationship. We call them 6 and 7, 6 and 7, 7 and 6, doesn't matter. Whatever happens to the brain, what disrupts the brain will disrupt the gut. And think about this. 70%, some say 80% of your immune system is right here in the gut. A large percentage of your endocrine system is right there in the gut. By the way, many of your neurotransmitters, like serotonin and dopamine. Serotonin is 95% created and used in the gut. Dopamine is 50% created and used in the gut. So you think about that. I mean, this should really revolutionize the way we treat strokes. So you've got to, my point being this, is that you've got to address the gut. You've got to address the gut. It doesn't make sense to me that a person, an expert, a neurologist, a physical therapist, a speech therapist will do everything to try and rehabilitate the person who has had a stroke and yet not do anything about the gut. And there are about 7 areas that you want to address when it comes to the gut. Part of it is, of course, the lining. What we now know is that if a person has a stroke, in some cases, severe strokes can actually lead to ulcers in the stomach. Are they called Cushing's ulcers? I think they're Cushing's ulcers. Check it out. Cushing's ulcers, or Cushing or curling. I think it's Cushing's. Cushing ulcers automatically happen in the gut if the stroke is severe enough. But some of these, some of what happens in the gut as a result of what happens in the brain can't just be seen with the naked eye, even if you open up the body. It's called leaky gut. So severe emotional stress and strokes can cause there to be breakages in the gut lining, making it more permeable. That's what doctors prefer. More permeable to food and other bacteria leaking out into the gut and into the bloodstream. So that has to be addressed. Another thing that has to be addressed are the microbiome. Again, if there's a disruption in the brain, the microbiome, which are the entire body of bacteria, viruses, and other foreign organisms that work in a synergistic relationship with our bodies, that whole body is disrupted. And once the body is disrupted, the body of that microbiome, that whole bulk microbiome, once that's disrupted, it's going to affect the brain function as well. So another thing that you need to start thinking about is using high quality probiotics that will help to restore balance to the microbiome. So probiotics are really good bacteria that help in the immune system, help in the endocrine system, help in brain function. That's another thing. So it's a whole body of work that needs to be addressed, not just the brain. And I want to keep on emphasizing that. Of course, like I said, we treat people with brain disorders all over the world. And if you have any issues or anything you want to talk to us about, please feel free to reach out. God bless.